When you have sciatica, moving can feel like walking through a minefield. You feel that sharp, electric zing, and your brain sends a loud, clear message. Stop. You're damaging your back. So you sit. You rest, and you become terrified of even the simplest movements. But what if I told you that in most cases, that danger signal is actually a false alarm? Today we're going to cover 3 movements that are safe, gentle, and essential for calming your symptoms down. Important notice. Before we begin, please be aware that this information is for educational purposes and does not replace a formal clinical assessment. Because everyone's spine and symptoms are unique, these movements should only be performed within a pain-free range. If you experience any red flag symptoms, such as sudden, progressive leg weakness, numbness in the groin or saddle area, or any changes in your bladder or bowel control, please stop immediately and seek a prompt, face-to-face evaluation with a doctor or physiotherapist. Think of your sciatic nerve not as a piece of machinery that is broken, but as a cranky, sensitive neighbor. When a neighbor is cranky, slamming the door or shouting at them only makes them louder. That's what aggressive stretching or painful exercise does to your nerve. But if you go over with a peace offering, something calm, consistent, and gentle, that neighbor starts to trust you. Your nerve doesn't need to be avoided. It needs to be reminded that it is safe to slide, glide, and move through the tissues. When we move gently, we aren't damaging anything. We are simply teaching the nervous system to stop overreacting. Here are 3 peace offerings for your nerve. Remember, none of these should cause an increase in your pain. If it hurts, do less. First, the gentle pelvic tilt. Lying on your back with knees bent, gently rock your pelvis so your lower back flattens into the floor, then release. It's a tiny movement like you're trying to flatten a grape beneath your lower back. It introduces gentle motion to the spine without strain. Second, the modified cat-cow. On your hands and knees, just find a comfortable middle ground. Arch your back slightly, then round it. Keep the movement small. Think slow and rhythmic rather than stretching. Third, the standing nerve slide. Standing, slowly straighten your knee while keeping your foot pointed down. If you feel a pull, back off immediately. It should feel like a light, rhythmic slide. Just a few repetitions, and you are done. Your homework today isn't a long workout. It is just a movement snack. Pick one of these 3 movements and do it for just 30 seconds. Once every 2 hours. That is it. It is about consistency, not intensity. You are teaching your brain that you can move safely. If you found this helpful, subscribe for more ways to retrain your pain. Let me know in the comments. What is one movement you have been afraid to try lately?